Hi, I'm Matthew, and I'm one of the psychosexual therapists in Share Psychosexual service. What I'm going to go through with you in this video is some information on male and female sexual response. Modern science and research into sex has started in about the 1960s, and since then, every bit of research that's been done subsequently has added to our knowledge, and what I'm about to go through is our most current understanding about what happens to both men and women when they have sex. Scientists have somehow managed to turn sex into a graph, and this illustrates what happens to both men and women when they have consensual sex. On the screen, you'll be able to see an example of a blank graph, just to demonstrate the axes. So the bottom axis is baseline, and this refers to somebody when they're in a non-sexual state of mind. On the top, you will see 5 stages, and those 5 stages are the same for both men and women. The first stage is drive. Researchers believe that there are 4 main things that might drive somebody towards having sex. Reproduction, because it's the way that we would have children. Pleasure, because it can feel good. Relationship benefits, and I can say a bit more about that because sex can be as much as an expression of love between people. However, on the more superficial end of that spectrum, a couple that are having regular good sex are more likely to be more tolerant of each other and just get on better. Finally, another driving factor is self-esteem, because having good sex makes people feel good about themselves. Assuming that one or more of those driving factors are present, somebody may then progress to the next stage, which is desire. Desire is psychological. It begins in the mind. Somebody having thoughts that are relevant to sex, but it's more than that. It's being able to connect to those thoughts, and that leads to what we call subjective arousal, or what you might call feeling turned on. That subjective arousal, that feeling of being turned on, is crucial in order for somebody to progress to the next stage of sexual response, which is the excitation stage. This is where the physiological changes start to occur. So these are the physical things that start to progress somebody away from their baseline state through the stages of sexual response. Some of these physical changes may be unnoticeable. Things like heart rate increasing, breathing rate becoming more rapid and shallow. Some muscles may become tense and then relax again. Things like bum cheeks clenching or toes pointing, for example. There are more specific sexual changes that occur as part of these physical changes that happen, and I will talk about those more specifically. I'll come back to those specific sexual changes shortly. The excitation stage is also where the sexual activity would occur. So whether that is somebody pleasuring themselves or whether that is a couple having sex. Lots of different things happen at orgasm at the same time, and we still don't understand everything there is to know about it. We know that there's a physiological, a physical dimension to it because a particular type of stimulation is required to reach it. We also know that there's a psychological aspect to it, because you have to take responsibility for your own pleasure to some extent and understand that an orgasm is possible. However, if you would focus on it too specifically, then it becomes more elusive. So there is a psychological component also. There is also a biochemical component, because there are certain chemicals that will get released in the body that contribute towards that sense of satisfaction that can come with an orgasm. Post-orgasm, somebody enters the final stage of sexual response, which is the resolution stage. This is where all of those physical changes that have happened go back to their baseline state. So everything goes back to the way that it was before. So those 5 stages, if you remember, are the same for both men and women. Now I'm going to talk through some of the more specific changes for men, and later I'll do women. On the screen you'll be able to see an image of a man in their baseline state. So these are the pelvic organs that you can see on this image. The glans of the penis is like the head of the penis, and the shape of the glans is called the corona. It's nothing to do with the virus. Underneath the glans is the frenulum, and if the man has a foreskin, that's where that would attach. All of the glans is covered with nerve endings. So that over and back type of stimulation over the coronal ridge will contribute towards male pleasure. The tube inside the penis is called the urethra, And if you follow the urethra, you will see that it originates in the bladder, because its primary function is to release urine from the body. Just underneath the bladder, you will see a gland called the prostate gland, and the prostate gland has several functions. One of them is urinary. However, the majority of its functions are sexual in nature. The prostate is responsible for producing all of the fluid that gets ejaculated when a man reaches orgasm, with the exception of the sperm cells, which are created in the testicles. The testicles are designed to hang outside of the body in a scrotum because for sperm cells to be at their optimum from a health perspective, they must be slightly colder than the rest of the human body. And that is why the scrotum is sensitive to temperature and may expand when a man is hot and contract if he's cold. The sperm cells are attached to the prostate via the vas deferens tube and the seminal vesicles, which you can see on the image. At some point during sexual excitation, the sperm cells will move through the vas deferens and mix into the prostatic fluid to fertilize it, and this solution is what then gets ejaculated. Another function of the prostate is pleasure, because the prostate is richly covered in nerve endings. Some of these nerve endings correspond to different parts of genitals, and the prostate can be indirectly stimulated by stimulating areas such as the perineum, the area between the testicles and the anus, or the anus itself. Some men may choose to stimulate the prostate more directly, and in order to do that, they would need to go up the bum with either a sex toy, or maybe a partner would do it with their finger. Not all men choose to do that though. It is personal choice. However, when done correctly, it can be intensely pleasurable. Just underneath the prostate, there's another small gland called the Cowper's gland. This secretes a fluid when a man is aroused, but before he ejaculates, colloquially known as precum. That fluid neutralizes the urethra because urine can be acidic in pH and sperm cells are more alkali. Therefore, the neutralization process makes sure that the sperm stay healthy on their journey from the prostate out. The previous image is a man at his baseline state. The next image that you can see is a man in the excitation stage of sexual response. As you can see, the penis changes in size, and that's because it has vascular tissue with the ability to fill with blood and hold on to it for a period of time. Eventually, it will become a full erection. The next image that you can see is later in the excitation stage, and I would like to point out that not all penises look the same size and shape as the one on the image that you're looking at. They come in all different shapes and sizes. On the image, you will also see that the testicles have rotated and elevated, and the scrotum has thickened. So, during the excitation stage, it may feel as though the testicles have disappeared back inside the body, and that's perfectly normal. Or if not disappeared, they will just look a bit closer and they won't be hanging as low as they usually do. When a man reaches the orgasm stage of sexual response, he ejaculates. Orgasm and ejaculation are two separate biological events, but they always happen concurrently. Post-orgasm, when the man enters the resolution stage, the penis will go back to the way that it was at baseline, which is like the original image that was shown. At the very latest point of the excitation stage, men have something called a point of inevitability. This is a point at which the man would find it impossible to resist progressing to the orgasm stage. There is a point just before this called the point of near inevitability. This is the point at which a man may feel that he's close to orgasm, and if all stimulation stopped at that point, it would be possible to resist it. However, if stimulation continued and he reached the point of inevitability, it may as well be enjoyed at that point because nothing can be done to stop it. Post-orgasm, in the resolution stage, there's a period of time known as the refractory period. This is a period of time in which a man would find it physiologically impossible to ejaculate again. Because men have a point of inevitability, it's been possible for scientists to study how long it might take a man to ejaculate. In order to study this, there were male and female participants, and they timed from when the man penetrated the woman up until the point that he ejaculated. They then averaged out all of these times, and the average time was around 5 to 6 minutes. For that to be the average, some of the participants will have been less time than that, and some will have been more. But 5 to 6 was around in the middle. There have been no equivalent studies for homosexual relationships. However, it's likely to be in that similar ballpark. I will now move on to women and the specific physical changes that happen during the excitation phase for them. Just before this though, I will talk about how things are at baseline. The majority of female genitalia is internal. The external part that is visible is called the vulva. You'll see an image of a vulva come up on the screen. In this image, you may be able to see the outer labia, which are the outer lips, and the inner labia, which are the inner lips. On the image that you can see, the woman is holding open her outer labia with her fingers. If she wasn't doing this, and she was to examine herself in a baseline state which is unaroused, it may be that she would not see the level of detail that you can see on the image. It may be obscured by the outer labia. However, vulvas come in all shapes and sizes, and some women would always be able to see that level of detail, and the inner labia may protrude. On the image, you'll be able to see 3 holes. The one at the bottom is the anus. Some women may enjoy anal stimulation or even penetration as part of their sexual practice. The area between the anus and the vaginal opening is called the perineum. The vaginal opening is where penetration might occur with a finger, a sex toy, or a penis, or a tongue. It's also where period blood would come from, or where babies would come from, if the woman had a vaginal delivery. The hole above that one is the urethral meatus, and that's where urine comes from. The area above that, you will see, is labelled as the clitoris. The external part of the clitoris is called the glans of the clitoris. And just this glans, the external part, has 8,000 nerve endings, which gives you an idea about how sensitive the clitoris is. It also has an internal structure, as it's a bit like an iceberg. You can see the tip of it, but it has a much larger part internally that is invisible. Due to the sensitivity of the clitoris, some women may not like to have their clitoris directly stimulated. They may prefer indirect stimulation, which can be done using the clitoral hood to cover it. The next image that you will see is the internal part of female genitals. On the image, you'll be able to identify the labia majora, the labia minora, and the clitoris. The vaginal passage, as you can see, is sandwiched between the bladder and the back passage. And this is a woman at baseline. So as you can see, there isn't space for penetrative sex in the vaginal passage at this point. Several changes would need to occur before that was possible without being uncomfortable. Above the bladder is the uterus or the womb, and the uterus is connected to the ovaries by the fallopian tubes. The uterus has a neck, a structure called the cervix, which is like a gateway between the uterus and the vagina. To the left of the image that you can see on the screen, you will see a skeleton, and on that skeleton is a pelvis. That pelvic bone has a sheet of muscle that runs right underneath it, and that's called the pelvic floor muscle. The pelvic floor muscle has 3 main functions. The first is that it holds all of your organs in the skeleton. The second is that it has a continence function. So this is the muscle that would be squeezed if somebody wanted to stop themselves going to the toilet, or relaxed if they wanted to go. The third function is an orgasmic function, because a level of strength is required in the pelvic floor in order to reach orgasm. The pelvic floor can be exercised with Kegel exercises. Both men and women can do Kegel exercises, and it is good practice. For more information on Kegel exercises, you can talk to your therapist. What we've just talked through is a woman at baseline. The next image that you'll see on the screen is when the woman enters the excitation stage. Lots of changes occur in this stage. Externally, in the vulva, it will begin to fill with blood. So the clitoris, the labia minora, and the labia majora will all start to get bigger. The effect that this might have is that the labia start to separate and elevate, and the clitoris may be more visible as it may start to protrude. Internally, the vaginal walls will start to secrete a fluid, which is used as a lubricant to facilitate penetration. This may be the first sign of arousal that the woman notices. However, there are other internal changes which may take slightly longer to occur. This is the uterus elevating from its original position to higher up in the pelvis, and this has the effect of lengthening the vagina. So as you can see on the image, there is much more space internally once the uterus is elevated for penetration. The next image that you will see is later on in the excitation stage. By this point, the labia may have changed colour because of the additional blood that is inside them. Internally, the uterus is fully elevated, so it is now quite far away from its original position. And this has a tenting effect of the cervix, which is called a full vaginal expansion. You will see now on this image that there is much more room and space for penetration than there was on the original baseline image. Follow the arrow from where it says orgasmic platform. This points to the first third in to the vagina. This is called the orgasmic platform because the nerve cells in that area have pleasure receptors. So stimulation of this part of the vagina will contribute, in addition to clitoral stimulation, to pleasure and ultimately possibly orgasm. The inner 2/3 of the vagina have baroreceptors. So the sensation, if this part of the vagina is stimulated, will be different. It may not necessarily contribute to pleasure, although that sense of presence may contribute to pleasure. What the woman will feel is more of a pressure. The next image that you will see depicts the resolution stage, and more specifically, this image shows a heterosexual woman who's just had sex with a man who has ejaculated inside her. The reason that I'm highlighting that is that you will see that the image shows a seminal pool. The uterus will descend back into its original position, and in so doing will dip into that seminal pool. Eventually though, most of that semen will come out of the vagina due to gravity. The resolution stage, basically everything goes back to the way that it was on the baseline image. Women do not have a point of inevitability in the same way that men do. Therefore, if they do not reach orgasm, that build-up of sexual tension is not released, and therefore the resolution phase takes longer to complete. You will see on the next image that unlike men, women do not have a refractory period, which means that after having one orgasm, it is physiologically possible to have another, and maybe another after that. Not all women have experienced multiple orgasms, and some, after one, do not wish to have another one. However, if the woman would like to experiment with the possibility of having multiple orgasms, it would likely take a degree of self-knowledge and experimentation, which may then need to be communicated to the partner, because constant and persistent clitoral stimulation would not necessarily be comfortable. There's no normal when it comes to how long it takes a woman to go from baseline up to orgasm. And when I'm working with a client with particular orgasmic challenges, I might suggest that she does various forms of self-pleasure outside of the session. I suggest that she tries this for up to 20 minutes or more, because it can take that long for all of the processes that we've discussed to take place. There are some differences between how long it might take a woman and how long it might take a man to go from baseline to orgasm. And that's why foreplay is so crucial, in order to maximise the arousal and pleasure that can be experienced by both partners. In this video, because I'm talking about similarities and differences between men and women when it comes to sexual response, some of it may come across quite binary. If you're heterosexual, homosexual, transgender, non-binary, just take from this video what feels relevant to your personal experience.